Good evening, everyone. Today is Monday, April 22nd. Um, I'm sorry that I didn't do the video this past Saturday. I was doing the training, the special needs ministry training for for um, the special gifts group that I'm leading. They got some really good evaluate or not just evaluation, but they got really good resources. Um, and I went to what is called the Highway Tabernacle Church. It was a good church, and man, I would say I learned a lot. I learned a lot um, from her name. Actually, her name is Tracy. She's the leader of the special needs ministry. So I learned a lot from her. I know she's going to go down to one church and to help train us. Man, if I think I have her card, so just give me a minute. I think I might have. Yes, I do have her card. Um, I don't know if you guys can see this. I'm not sure, but if you can, I would say just go uh to it's called core special touch dot at gmail.com. um it's um it's pretty awesome. I don't know if you guys can see it on here, but um it's a really good valuable resources. So if if I were you, just press pause and click the either the QR code or and or you can go to her website. Um, she does she teaches you a lot of things about people who have special needs and things like that. Which is great. It's really great, very powerful. Um, but as you know, today's topic that we're going to talk about is autism or autism spectrum disorder. So, um, what is autism or autism spectrum disorder or ASD? Still kind of the same thing. So, it refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. Uh, According to the Centers for Disease Control, um, or CDC, autism affects an estimated 1 in 36 children and 1 in 45 adults in the United States today, according to autismspeaks.org. Um, so basically, as you can see, I have ASD, I also have ADHD and Tourette's. Also have Tourette's. But it does affect my communication skills. You see, uh, I'm okay with my communication. I've been practicing a lot dealing with my communication skills. However, it's still not up to par where it really needs to be at. Um, According to, I would say, the college, it's really not up to, let's say, the college level that I really need to be at. Um, there's also n- not professionally, like I struggle a lot communicating professionally to either to my coworkers or to the YouTube in general. But I am doing the best I can, um, and I'm giving it my all. Um, but in the meantime, I do struggle verbally. I do struggle intellectually, but it doesn't stop me to continue to doing what I'm doing right now. I'm still continuing to reach out to the special needs community. Still continue to talk on on YouTube and not giving up because the way I talk. Um, I guess I'm talking okay, but sometimes when I hear myself, sometimes like I'm just thinking like, I shouldn't say this or I shouldn't say that, and it's part of practice, But you know, I still will stay my point. I still will get my point across. What needs to be done. Uh, in the meantime, um, autism looks different for everyone, and each person with autism has a distinct set of strength and challenges. Some autistic people can speak, which is true. Um, what was his name? Oh, um, there's one guy in my special gifts group. Um, he has he does have autism, but he has high functioning autism. And boy, like I wish he, still would have continued in our class because he's really good at being a what's it called? Narrative. He's a really good narrative reader. When he reads, he uses that awesome narrative voice. That I guess that gets people craved or something. Um, but he's really good at narrating what he's reading, and he's good at that. Other people is good at speaking. Um, for example, Liz. Yeah. um, she's. I would say she's really good at speaking. She speaks very well. Um, and so on and so forth. But anyways, continue on. Um, so yeah, some autistic people can speak, while others are nonverbal or minimally verbal and communicate in other ways. Um, I know for me, I would say I'm like right. I'm right in the middle. I'm not the best speaker, but I'm not like um, down below. Like I'm not the worst speaker. So it's like I'm like right in the middle, so to speak. Um, some have intellectual disabilities, while some do not. Some require significant support in their daily lives, while others need less support. And in some cases, live entirely independently. So, to be honest, there's autistic people, some autistic people everywhere. Um, but you never know until you actually get to know the person. Once you get to know the person, then you know like they have the autistic tendency and so on and so forth. On the average, autism is diagnosed around age 5 in the U.S. Um, I I do agree with that, but sometimes, like in my case, I didn't get diagnosed until after I graduated high school. Actually, I didn't even know until um, yeah, until I graduated high school. That's when I knew um, I was autistic. With signs appearing by age 2 or 3, current diagnostic guidelines in the DSM 5TR break down the ASD diagnosis into 3 levels based on the amount of support a person might need. Um, 1, level 2, and then level 3. Um, so, so let's see, autism spectrum disorder, DSM 5 diagnostic criteria. Uh, I'm actually looking at these website on autismspeak.org. Trust me, it's in there. So it says one deficiency and social emotionally res- re man talk about putting like these tough words in there. Reciprocity, ranging for example from abnormal social approach and failure of normal back and forth conversation to reduce sharing of interests, emotions, or affect to failure to initiate or respond to social interactions. Two, deficiency and nonverbal communicative behaviors used for social interaction ranging for example, from poorly integrated verbal and nonverbal communication to abnormalities in eye contact. Basically, what it means like um they avoid eye contact. They don't speak very well. Um, you know, they like rock back and forth, um, and so on and so forth. That's, part of their behavior. And body language or deficits in understanding and use of gesture to a total lack of facial expression and nonverbal communication. Deficits in developing, uh, maintaining and understanding relationship ranging, for example, from difficulty adjusting behaviors to suit various social contexts to difficulties in sharing imaginative play or in making friends to absence of interest in peers. Um, so these are just a lot of different different things. Um, Here's the other one. So it says many people with autism experience other medical behavior or mental health issues that affects their quality of life. You know, attention deficit hyperactive disorder or ADHD, which I have, anxiety and depression. I used to have depression. I don't have that anymore. Um, and the reason why I did have depression was because, I've been rejected all my life, been alone, was trying hard to make friends, and it always failed me, and, you know, it was tough. Gastro, was it gastrointestinal disorder? Uh, Never heard of that. Seizures and sleep disorder. That I hear that sometimes. Um, Anybody can be autistic regardless of sex, age, race, or ethnicity. However, research from the CDC says that boys get diagnosed with autism 4 times more often than girls. That is true. That is very true. Um, Boys do have 4 more times, or not 4 more times, but 4 times uh, more often can get autism than girls. Think about that. Um, Let me see. According to the DSM 5TR, the diagnostic manual for ASD autism may look different in girls and boys. Girls may have more subtle presentation of symptoms, fewer social and communication challenges, and fewer repetitive behaviors. Their symptoms may go unrecognized, but doctors often leading to undiagnosis or misdiagnosis. Getting a diagnosis is harder for autistic adults who often learn to mask or hide their autism symptoms. Autism is a lifelong condition, and an autistic person needs strength, and challenge may change over time. As they transition through life stages, they may need different types of support and accommodations. Early intervention and therapies can make a big difference in person's skills and outcomes later. So, um, as you can see, uh, you know, autism is it's not easy. It's not easy at all. So so basically, what are you know I know people was asking me, or some people was asking me, what are the signs of autism? Signs of, you know, signs or symptoms of autism. Well, I would say the first one to look for is the communication part. Um, the way you'll find out is through the communication. So basically, to um, according to Easter Seals, it says communication autistic. Well, basically, it says autistic adults and children may interact with others differently. They often appear to have difficulty understanding and expressing emotions and may express attachment in different manners. Many autistic individuals rely upon nonverbal methods of communication, such as pointing to pictures or using a tablet computer with special language application. And if you can excuse me for a little bit, but my dog, I have to let my dog out. Uh, yeah, I mean, we all got pets. We all got pets and things like that. So, uh, in the meantime, um, so dealing with me, I struggle with communication. Um, in the past, from my experience, I don't know how to verbally like express my feelings of how I feel about things. And so I act out. Sometimes I act out of anger. I get frustrated. I break things. Um, you know, and like, because, sometimes I feel like I'm not being heard. So, like, you know, and like, you gotta, I'll tell you this, you got to let the let them know, let the person that has autism know that, hey, I hear you, I understand you, just calm down, explain to me, what's wrong. You can even paint a picture of how you feel about things. You can, do the acting thing or acting role. Um, you know, just let them know that, hey, I know you're upset. I know you're frustrated. Um, because that way it makes it easier for them that you're listening. Because sometimes some people don't listen, and like, and I mean, I understand that, but like, even with me, I do much better. I'm not like breaking stuff like I used to, or you know act out of character, but it does get tiring sometimes. But I mean, I do have those type of urge where I can do that. But, you know, with God and the Holy Spirit, he's working with me. Um so stimming is another one. One type of vocal stimming is called alkalolia, the non volunteer repetition of sound. Individuals with autism often have difficulty understanding the non-verbal aspects of language, such as social cues, body language, and vocal qualities, pitch, tone, and volume. So sometimes, how would I say this? I think so. Sometimes intellectually, when let's say you guys are trying to explain something to me and you guys using big words, like, we won't get it. We won't get what you're talking about. It'd be easier for you guys to like break it down to, like, let's say a 5-year-old can understand than, like, a college student. Um, Sometimes you have to break it down that way to, help us understand you a lot better. Um, Here's another sign of, and I do this a lot too, schedule and routine. Autistic individuals often have a great need for routine and order, which can make them upset if objects in their environments or time schedule changes. So I I'll give you one example. Um, so like, I always have to have this routine, you know, and always have to keep in schedule because I do not like when um I don't like it when, like, when I have to do other things at the last second without like planning stuff. That's what I meant to say. So, like, one example, my routine was that, I get up, brush my teeth, and all that stuff, eat breakfast, go to work, go to the gym, come home, do laundry, and then uh, eat, and then do the YouTube, and then, you know, of course, call my fiance, and then go to bed. Um, what I don't like is, let's say, my dad wants me to uh, cut the grass, um, or that he have wanted, or yeah, had me want to cut the grass without telling me this earlier. Cause I mean, I already know, like, I already took a shower and things like that. I don't want to go through that sweatiness and all that. Again, and just taking a shower. It's just waste, not waste of water, but like a waste of like my clothes, waste of like shower and all that other stuff, and it just, yeah, it drives me nuts. Um, so we just like to be on our routine. We just don't like to be knocked off out of our routine. It like, I don't know how to say it. Drives me bonkers. Um, and like sometimes I do get irritated sometimes, but I know how to manage it pretty well, and not acting out. That's grace of God working on me. So, um let's see. Children with autism may not play with toys in the same manner as their peers and may become fixated on specific subject objects. So basically, it just means that um, there's certain things there's certain things like I don't like to play with. So like I I don't like to play with let's say action figure. I used to have action figure when I was younger, but like I got older, um just didn't like it. It's just you know. But I do love playing with Legos, so I do like that. Also, when it's talking about fixated on specific objects, it actually means that like I get fixated on like the same problem. Like I keep talking about it. I keep talking about it until like I solve the issue. And like I know some people don't like to hear it, don't like me to, you know, say it, or I'll say this. Yeah, some people just don't like to hear it. However, sometimes I repeat myself 4, 5, 6 times until the problem's already solved, until I actually fix the problem. It's I don't know, it's part of my autistic behavior that I have. Sometimes I do that, I don't mean to. It's just, when I'm frustrated and stressed out about certain things, I do tend to repeat myself on the same problems until it's solved. Um, let's see what else. Oh, autistic people may have a different reaction to sensory stimuli by seeing, hearing, feeling, or tasting things with more or less intensity than than their non-autistic peers. Um, so they are stimulated by certain things. Um, Hearing, feeling, tasting like noise. They get stimulated by noise, so it bugs them. They also get stimulated by their shirt, you know, and it bugs them. Like for me, I get stimulated by the tag. So like, I always have to rip that tag off because if I don't, it just bugs the crap out of me. Um, and so on and so forth. Um, I know one person in my class is stimulated by his cell phone, and like he does get overstimulated by it, and of course we have to, take it away before he goes to class, um, and so on and so forth. So motor skills. Children with autism often have a different rate of development, especially in the areas of communication, social, and co-initiative skills. In contrast, motor development may occur at a typical rate. Autism spectrum disorder is a lifelong disability that is generally diagnosed before the age of 3 years old. However, children are often misdiagnosed, like me. I was misdiagnosed. People thought I was just ADHD, but it was actually more than that because I couldn't communicate to people. I struggle with that. So often misdiagnosed or not diagnosed until later in life. I was misdiagnosed um, at the age of 5, um, and I didn't realize I have autism until after I graduated high school. I did went to therapy, and they, told me yes, I have this, and I went to therapy later on in life in my late 30s, and well, in my 30s, and still, same results. Um, and so on and so forth. The American Academy of Pediatrics suggests parents consider the following question: does your child speak differently than their peers, avoid eye contact, not respond selectively to their name, act as if they are in their own world, seem to tune others out, um, seem unable to tell you what they want, preferring to lead you by the hand or get desired objects on their own, even at risk of danger. That used to be me. Um, have difficulties following simple commands. That is 100% me. I struggle a lot with commands. Like people will give me specific instruction, and sometimes I just lack um specific directions because I just don't understand some of the directions that they give me. And a lot of people, including my dad, gets frustrated with me. Even, my past relationship, they all get frustrated with me because I struggle with uh, following, their directions because I just don't understand the the description of their direction, and I have to have them break it down to let's say a 5 year old can understand in order for me to follow the simple commands. So I do struggle with that a lot. Um, Not point to interesting objects to direct your attention to objects or events of interest. Have a meltdowns or a long emotional outburst. I used to be that way, just not anymore. Have repetitive stereotypic behaviors, depending on what it is. Show a strong attachment to inanimate objects, especially hard ones, flashlight or a chain versus teddy bear or a blanket. uh, yeah, that could be possible. Prefer to play alone. Um, I wasn't that way. I actually do like playing with people and not engage in pretend play if older than 2 years. Um, so what to do if you think your child has an autism? Well, that's a good question. Autism affects each individual differently at varying degrees, which is why early diagnosis is so crucial. Autism is a lifelong disability, and early intervention often contributes to lifelong positive outcomes. Get a diagnose. If you're concerned, see a doctor who's familiar with autism. Find support. Education, intervention, and speech therapy are often critical. Contact Easter seals or basically contact your doctor for services or assistance location service providers in your area. Um, and then know your rights. Children with autism can be eligible for early intervention and special education services that are free starting at age 3. Your health insurance may include coverage for the medical service your child needs, and it can help you navigate the system. Also, um, the one advice I would give you with this is um go to like I would say your family doctor or therapist that will help you or help your kids that does have autism. Just help them with their motor skills, their speech, and all those things, and they will work with them. So you should take your kids to therapy. Have them help them, and they'll do okay. In the meantime, um, let me see. I had um one of the uh I would say one of the tools that I actually learned. It was man, it was awesome. But for someone, I would say for someone that has let's say intellectual disability with autism and stuff like that, the tools that you should use is one of the tools. Okay, so there's 7 different ones. So the first one is directions in more than one way. Um, so you gotta give them directions more than one way. Second one, you do have to repeat to them 2, 3, maybe 6 times in order. It's like you have to drill it into their heads in order for them to not only understand but not forget. The third one is break and from what's it informational and yeah, break the information down to smaller chunks, which means break it down to where like a 5 year old can understand. For ask comprehension question, ask them questions, and have them to think, have them to, have people with autism, use their brain a little bit. Seven, sequential, and then, well, actually, six, multi-sensory, and then seven, sequential. That's how you work with with um, intellectual disability that has autism. And believe me honest, I do have autistic. Um, and I just want to let you know that, us, I would say autistic doesn't define me, of who I am. It doesn't stop me. It, in fact, in fact, uh, it makes me the person as I am right now. Um, and so on and so forth. You know, autism doesn't make me dumb, stupid, or anything. In fact, it makes me really smart. Um, we we can see and do things that other people who are regular, I usually call them quote unquote regular, um, that does not. Um, so, for example, I can see pictures when I do troubleshooting at my job because I do electronics technician. Most people who does technician, they'll usually try to identify the problems and troubleshoot, use their probes, find the components, where the problem is with the components. With me, on the other hand, I do it by pictures. So I identify the problems, I see the pictures, I see what's wrong, and I know the components. I know that this component is bad without me even doing the troubleshooting, without, putting the probes on each side. I know where it's at because I see it through the picture, and that's how people with autism, this is how we, think and fix things, and we do like a lot of bigger picture stuff. We just do things in a different way than what regular people do. So, like, as you know, like, I just, when I troubleshoot and fix things, I do it by picture. And I see where the problem is at without me even using any tools. So, and I was the fastest troubleshooter in the nation. It's just a lot of people just don't see that because, you know, um, because of the autism and the communication skills and things like that. But anyways, I just wanted to let you know. Thank you for watching this video. Um, and I will see you on the next one. All right, take care. Bye. Thank you for watching this video. As you can see on the black screen, please click the like button, subscribe to my channel, and click the notification. Thank you.